You know, it's really hard to get an insider's perspective of what it's like day in and day out in Gaza. But we have an opportunity to get that from the perspective of Dr. Aqsa Durrani. She's a physician and board member with Doctors Without Borders. She spent February to April of this year in Gaza. So now the organization has been forced to suspend its activities in the region during a time where a new report from Save Our Children estimates the war between Israel and Hamas has killed nearly 20,000 children. Dr. Durrani, first of all, thank you so much for joining us today. Does that number surprise you?
Absolutely not. For 2 years, we have been witnessing indiscriminate bombing relentlessly in the Gaza Strip. I was there, as you said, February to April of this year, but what I witnessed is not anything that hasn't been live streamed and in plain view for the entire world to see. So, in fact, my concern is that based on the number of patients we saw pulled out of the rubble, the concern is that those numbers could even be underestimates. And having had to pull out of Gaza City, we have left vulnerable patients without care. That means newborns, that means new mothers, patients with severe illnesses and amputations, and these patients cannot flee. The week before we had to make the decision to suspend our operations, our clinics saw more than, thousands of patients, and now those patients are left without care. And this is why we have been calling on world leaders to help us end this genocide. Doctors Without Borders, doctors cannot do this alone.
What is your reaction to the reporting that Doctors Without Borders is now not able to access? Why is that? How is it explained to you?
I'm sorry, I didn't understand the question.
Doctors Without Borders reportedly has not been able to access certain areas. Is that true, first of all? And what's your reaction to that? And were you given any reason for that?
So there are areas throughout the Strip that are militarized, and this is not uncommon at all. We are frequently unable to access certain areas due to the militarization and forced evacuation and forced displacement orders. So, around 80% or more of the Gaza Strip is under such orders, and so it's frequently completely unrealistic or unsafe for us to even access those areas. And this is part of the reason why we had to pull out of Gaza City, because the airstrikes and the tanks advanced within less than a half a mile of the facilities that we were working in. We have already, our staff have faced untenable risks, and this level of risk was beyond what could be tolerated. We've already had 15 of our colleagues killed, 3 in just the last couple of weeks alone. And so these risks are risks that we just have to continually, reevaluate. And then we are now forced to have to pull out of certain areas.
Israeli Prime Minister Benjamin Netanyahu has said that members of Hamas use innocents as human shields. Did you see any evidence of that?
What I can tell you is that I never saw any militants in any of the hospitals that I was in. I was in a field hospital, I was in built hospitals, and what we witnessed was the destruction by the Israeli forces of every fabric of society. And when I say indiscriminate bombing, it's because what you witness when you enter the Strip is a dystopian reality where civilian infrastructure has been entirely destroyed. While I was there, we were also under severe blockade, which continues to this day. And so supplies, medication, fuel, and water, all of these things are all being blocked. And this is what we witnessed, is that the collective punishment of the Palestinian people, and the reason that we call this genocide is because we witness a systematic and total destruction and impact on the entire Palestinian people in the Gaza Strip.
So what is the desire of the Palestinian people? Certainly we know that they hear the reporting. They know that these negotiations, for instance, are going on in Egypt. We have heard Israeli leaders send messaging to the Palestinian people that, look, you are being used as a human shield. You are being used while Hamas lives much better than you do. in these very perilous circumstances. Are you hearing that? And what are you hearing from the people on the ground, the Palestinians, in response to all of that messaging?
What I hear from my colleagues is just that they want an end to this. People are exhausted. They have undergone relentless trauma. They have been displaced upwards of 15 to 20 times. So what they are personally telling me is just that they want this to end. They want peace. They want security. They want to be able to provide their children with the basic needs of life. Shelter, water, food. That is what they want.
Dr. Aqsa Durrani, we appreciate the conversation. Thank you so very much.